You're watching Sarcoma TV. Knowledge is power.
So one of the biggest problems with treating sarcomas, the standard care for medicine in oncology has always been treating a tumor based on the tissue of origin. And the way that is determined, since chemotherapy drugs have been here, which first occurred in the late 60s, early 70s, chemotherapy drugs are a class of drugs that typically are defined by inhibiting the reproduction of cells that happen to be rapidly reproducing. So they interfere with the reproduction cycle of the cell. And so since cancer cells are constantly growing and constantly dividing and reproducing, the chemotherapy drugs will interfere with that process. So when you get chemotherapy, basically what happens is the chemotherapy is either given to you orally or it's injected into you, and it will last typically a few hours in your body in its active form. And during that period of time, it will kill any cell that happens to be rapidly reproducing, whether it's cancerous or a normal cell, such as a hair cell, or, there's a lot of normal cells that happen to be rapidly reproducing: immune cells, hair cells, the skin cells, the lining of organs. So that's why chemotherapy has a lot of side effects. The other thing is chemotherapy will not typically affect a slow-growing cancer. Sarcomas typically do not have a high, what we call, proliferation rate. So they are often slow-growing. Doesn't mean they're any less dangerous, but because of that, chemotherapy is not as useful on them. Chemotherapy does not affect the stem cells that have created the cancer. So cancer is basically a disease of the DNA, and it's the DNA in a type of cell called an adult stem cell. And so these adult stem cells are unique cells. They're about 1 in every 4 to 6 million cells. And what they do is they produce a bunch of different progenitor cells. They call them daughter or progenitor cells. And those progenitor cells go on to repopulate and fix tissue. So for example, if you get a scar or a cut, if you get a cut, what will happen is the stem cells near the cut will produce a bunch of skin cells. They'll form a scar, and then that will grow over with skin and be replaced by skin. That's all done by the stem cells. So once the stem cells have finished doing their job, they get turned off and they're put into a state called quiescence, which is a very unresearched state of existence that we don't know much about. It's kind of the cells are still alive, but they're not very metabolically active. And because of that, they're also able to resist chemotherapy. So the chemotherapy is great for targeting the bulk of the tumor, but it does not affect the stem cells that have caused the tumor in the first place. The only way to get the stem cells that have caused the tumor out is with surgery and sometimes radiation. So chemotherapy is great for reducing a lot of tumor cells, but it doesn't actually solve the problem, and the tumors eventually come back. And we can see that, when people get certain chemotherapy drugs and they lose their hair, as soon as they go off the chemotherapy drugs, the hairs come back. And that's because the chemotherapy drugs affected the hair follicle, but it did not affect the stem cells that produce the hair. So that's, a perfect example of what's going on there. So common chemotherapy drugs, doxorubicin, eribulin, gemcitabine, ifosfamide, and then trabectedin, which is a new one that comes from, or relatively new one that comes from a C-squirt. So these have been used on a variety of different sarcomas with varying response rates. And each sarcoma is going to have a combination of chemotherapy drugs that are used in standard care. Not necessarily effective, but they're often used just to try to slow things down.
Thank you for watching Sarcoma TV. Subscribe below and stay informed.